Good morning. I am Linda Lambert. It is my pleasure to welcome you back to Day 2 of BARDA Industry Day. We are very excited to have more than 2,000 people participating in BARDA Industry Day from around the country and beyond. Connecting the innovation community with BARDA's team of scientists, clinical, technical, and contracting experts, and others on our staff is a very important part of what BARDA does. Our mission to support, develop, and procure medical countermeasures for public health emergencies depends on all of us working together. At BARDA Industry Day, we help create new collaborations as well as strengthen existing ones. And we are so very glad that you are here. We are delighted to have with us this morning 2 House members who will lead the Pandemic and All Hazards Preparedness Reauthorization Act next year, and excited to hear from them their reflections and perspectives on BARDA. Our first speaker this morning is Representative Richard Hudson. Representative Hudson is serving his 5th term representing the 8th Congressional District of North Carolina and was elected by his colleagues yesterday to serve as the NRCC chair next year. He is a member of the Health Subcommittee of the Energy and Commerce Committee, and along with Representative Eshoo, co-chairs the Congressional Biodefense Caucus. Representative Hudson's priorities include making health care more affordable and more accessible, improving health care for our veterans, addressing the tragedy of veteran suicide, harnessing all sources of American energy to lower costs for everyone and create jobs in North Carolina. And he has also led efforts to clean up chemicals in our drinking water. Please join me in welcoming to the stage for his reflections and perspectives on BARDA, Representative Richard Hudson.
Thank you so much. Thank you, Linda. It's really great to be with you, and I'm always honored to share the stage with my good friend Anna Eshoo, who will be speaking next, I believe. But first, let me just say thank you to all of you who work at BARDA. The work you do is really important, and it matters to our country. And so thank you for your dedication. Thank you for what you do every day. And thank you for your consistent leadership in hosting this Industry Day. This annual event is a great opportunity for government entities to engage in an open and collaborative environment with our private sector partners, where we share ideas, build relationships, and learn from one another. Now that Republicans looks like we're back in the majority by the skin of our teeth in the House, I am excited to get back to regular order in our committee. You know, the Energy and Commerce Committee is an important committee, but it's one that has a history of working together to get big things done. And frankly, when you've got divided government, in my opinion, that's when you can get big things done, because you get to share the blame with both parties, right? And you get to share the credit. And so I'm very optimistic that we can get big things done in the next Congress. And as we look to the reauthorization of PAPA, the Pandemics and All Hazard Preparedness Act, next year, I think this discussion today is very timely. I was tapped to lead the pandemic preparedness response for the Republicans in the House. And again, PAPA is number one on our radar. And I am really honored and excited to be working with my friend Anna Eshoo. With her longstanding knowledge and expertise in this space, I'm grateful to have her as a partner, and believe that during this process, because of our shared desire to ensure this bill is successful, I believe it will be. You know, I have to say, when you call someone a friend in Washington, that's kind of like a Southern lady saying "bless her heart." You wait for what's coming next, because it might be pretty ugly. But in the case with Anna, we are friends, and we do respect each other. And so I truly am looking forward to working with her going forward. And as we witnessed during the COVID-19 pandemic, public health emergencies don't care about political affiliation. And so examining how our country can best prepare and respond to these crises or issues that really are important to both parties. And so I'm going to work very hard to make sure that this is a bipartisan process, and frankly, I think you get better policy that way. But I also will work to ensure that this process remains collaborative and engaging as Congress examines the lessons from the last pandemic and determines how we can best prepare for and respond to future health security threats. I want to hear from you. I want to hear from industry. And I want to work very closely with you. Over the past 2 years, I've started these conversations in an effort to begin to lay in the groundwork. And some of the things I've learned, number one, is that public health security is national security. Proper preparedness and response requires collaboration across government and private sector. So again, I think this is very timely, and thank you for holding this Industry Day, because I think forums like this are so important as we prepare the next steps and look ahead to the next 5 years. It's been a long-standing priority of mine to support strong and continuous partnerships between public and private sectors, stakeholders. And these partnerships are critical to a successful public health security enterprise. Ensuring that we continue to build upon and promote these partnerships will be a priority of mine looking ahead with PAHPA reauthorization. This is also a main pillar of the work I've done with the Republican Healthy Futures Task Force. This last summer, Leader Kevin McCarthy created 6 task forces where all Republicans in our conference got together to plan for the eventuality that we would be in the majority in this next Congress. And I was put in charge of the Health Security Task Force along with Representative Jim Banks from Indiana and Tom Cole from Oklahoma. And over the past year, our subcommittee has solicited feedback on how to strengthen our nation's pandemic preparedness and supply chains mainly from private industry sources. And many of the folks who are joining us today, either here or remotely, provided submissions to us and responded to our requests for information. So thank you for that. Our goal is to ensure that we are best positioned and mission ready for the next emerging health security threat, whatever that may be. As you may imagine, much of the work was done with an eye towards reauthorization of PAHPA. One major reoccurring theme we heard over and over from stakeholders and of primary importance of this group and discussion today was to ensure HHS and other government entities were properly collaborating with, utilizing, and enabling private sector enterprise and expertise and capabilities. We must build on the public-private partnership infrastructure that was built during the COVID-19 response and drove the development for diagnostics, therapeutics, and vaccines. Second, we must reaffirm our Public Health Emergency Medical Countermeasures Enterprise, or PHEMSE, mission to ensure our preparedness infrastructure and response agencies remain dynamic and flexible and able to shift seamlessly between administrations and emergencies. There are several proposals currently being discussed that would help streamline and strengthen the preparedness leadership structure while also ensuring accountability to the American public. These include a new White House mission control concept, as well as discussions around elevating and reorganizing existing roles to ensure a clear authority and decision-making structure. Now, I don't believe these proposals are mutually exclusive. I think we must work to use all tools at our disposal to ensure we're instilling strong, empowered, and accountable leadership infrastructure. And I look forward to having discussions with you about ways you think we can achieve that. But I want to make sure that you've got an organization that has the funding, has the flexibility, has the authority to do your mission the way you know it needs to be done. Third, we all witnessed the success of Operation Warp Speed. I want to see Congress build on this model and ensure continued research and development of medical countermeasures to combat 21st century health security threats. And to do this, we must provide reliable assurances to our industry partners. They are the ones who need to take the risks, the financial risk, and allow innovation to flourish. This includes continued, reliable, and robust investments into our public health security and entities such as BARDA and SNS and Project BioShield. As many in the industry witnessed during the pandemic, partnering with the government can come with great opportunity and great potential for growth. However, it can also come with substantial risk when federal support is not reliably sustained. As we think through proposals such as warm-based manufacturing and reserve capacity, which would require significant long-term investments from our private partners, we must ensure we're providing dependable and consistent support and investment. And when I say that, I'm pointing the finger at myself. That's Congress's role. This is especially true in the biodefense and medical countermeasure space, where there is potentially and hopefully a chance these investments will never be utilized. So for the most effective public-private partnerships, we must provide partners long-term contract clarity and sustainability. This will allow them to plan ahead, invest in appropriate technology, and routinely engage in exercises to ensure we can rapidly scale up in the event of another national health emergency. As we saw during COVID, instead of over-reliance on government, we need to increase private sector collaboration with government. For example, just look at the monkeypox vaccine. We're seeing benefits of long-term continued investment in private-public partnerships play out before our very eyes today. The only vaccine in the world approved for vaccination against monkeypox exists because of long-standing public-private partnerships that began more than 20 years ago. While development of a smallpox vaccine began in the early 2000s, the vaccine was not approved until 2019. This means 2 decades of investment, from research to development to manufacturing to stockpiling, before the threat was eventually realized. Now, while COVID-19 pandemic displayed extraordinary challenges and holes in our health security preparedness and response, it also presented many opportunities to make lasting improvements. As members of Congress, we must learn from past mistakes and current successes. We must not be short-sighted in our preparedness and response measures. We must use these lessons to ensure we are prepared for any future threat, whether it be chemical, biological, radiological, nuclear, or another emerging infectious disease. These CBRN threats, that's what keeps me up at night, frankly, especially when you see the situation in Ukraine and the instability that's creating. As I continue to work with Representative Eshoo and our colleagues on these important issues, I look forward to continued conversations with BARDA and with our industry partners as well. One thing is certain, addressing these issues requires bipartisanship, it requires collaboration with our partners here in this room, and I encourage all of you to continue engaging in a bipartisan discussion with members of Congress and our staff, and really the necessity of public health security investments is what you need to emphasize, particularly as PAHPA reauthorization quickly approaches and our congressional work intensifies. September is going to come fast next year, but we all have a role in making sure that my colleagues understand the challenges, the threats, and the need for continued investment. Leaders like you have the firsthand experience to know what works best and what doesn't. So keep sharing that knowledge with members of Congress and our staff, and working together, we really can improve the status quo and encourage what we know from your experience works. Thank you again for inviting me today, and I hope you enjoy the rest of your discussion. And with that, I'll turn it back over to you, Linda. Thank you so much. Thank you.
Okay. All right, so let me officially thank you, Representative Hudson, for sharing your thoughts on pandemic preparedness and response, the importance of partnerships with industry, and your support for the reauthorization of PAHPA. So our next congressional representative I'm very excited to introduce, it is Chairwoman Anna Eshoo. And she knows a lot about innovation, especially since she represents California's 18th congressional district, which includes Silicon Valley, and she wrote the law that created BARDA. She chairs the Health Subcommittee of the Energy and Commerce Committee, and along with Representative Hudson, co-chairs the Congressional Biodefense Caucus. Of the 41 bills that she has authored that have been signed into law by 4 presidents, more than half have been health-related. Chairwoman Eshoo's bipartisan accomplishments demonstrate her ability to achieve results and reflect a clear vision for America's future across areas that include women's health, health insurance reform, pancreatic cancer, pediatric health, medical device reform, and public health security. please extend a very, very warm welcome to Chairwoman Anna Eshoo.
Well, good morning, everyone. How are you? Everybody awake? Good. It's really wonderful to be here with you. I want to thank Linda Lambert for your very kind introduction. I wish my children were in the audience so they could have heard all the wonderful things that you said about me. I'm really pleased to be here, and it's a special invitation. And I've been eager ever since the invitation was extended to all of you at BARDA, all of the employees, the private biotech partners that are part of this today. I understand that there are some 1,500 that are participating in this today. So bravo to all of you. That means that you're very important. That there are so many that are participating today. Over the last few years, and we all know this, everyone's life has been upended in some way, shape, or form. These are some of the toughest years in the history of our country. Historians are reminding us of that. During this challenging time, you've demonstrated a strength and a perseverance in your work, working around the clock to battle COVID and so many other health threats. I've always been proud, very proud, that it was my original legislation that created BARDA. And without BARDA's important work, we would not have been blessed with a safe and effective COVID vaccine as quickly as we were. So bravo to all of you. Bravo. I couldn't mean that more. I have a deep sense of pride in your work and how you've done it. BARDA has been hugely successful. And again, I have a deep sense of pride about that. I often hear from constituent companies in my congressional district rave reviews. Actually, yesterday, I met with a startup biotech from Palo Alto, which is the heart of my congressional district, who, thanks to a public-private partnership with BARDA, are developing a precision therapy for sepsis. Sepsis is the leading cause of death in U.S. hospitals. So I'll continue to do everything that I can to ensure that BARDA receives the robust funding and the support that you need in order to continue your vital work. And that, of course, includes reauthorizing the Pandemic and All Hazards Preparedness Act. We really come up with long titles, don't we? But in the design of the long titles, you always want to come up with what the abbreviation is. So it's PAPA before it expires next September. The past few years have shown the importance of ensuring that our nation is prepared to respond to a wide range of public health emergencies, including infectious diseases, natural disasters, or man-made attacks. I originally began my work on PAPA after the horrific September 11th attacks and the anthrax attacks that followed. Congress realized that our country was not prepared to coordinate responses to mass casualty events or chemical attacks. And in 2006, I wrote legislation with then Representative Richard Burr to address these shortfalls. That important legislation, the original PAPA, was signed into law that same year. So over the years, PAPA has been reauthorized and updated to strengthen our nation's existing preparedness and response programs. The 2023 PAPA reauthorization has to meet the challenges that we witnessed during the COVID pandemic and anticipate the challenges. That's very important, to know how to anticipate the challenges of the future. An example, I don't think I will ever forget the rest of my life the images of our medical professionals putting on plastic trash bags because they lacked proper personal protective equipment. So we have to make sure that our stockpiles are adequate to prevent these types of shortages. COVID also exposed the fragility of our supply chains, especially for pharmaceutical and medical products. These are critical goods that we literally cannot live without. Earlier this year, the National Academies published a report to identify ways to enhance the resilience and the security of America's medical supply chains. I asked for this report in the CARES Act. The report details policy proposals to improve stockpiling management and to increase our nation's capacity to protect against supply disruptions or demand shortages. Securing America's medical supply chains is a top priority for me for the 2023 PAPA reauthorization. Finally, it's a priority for me to see that the PAPA reauthorization is a product of bipartisan negotiation and compromise. There will be slim majorities in the House and the Senate. So in order to pass meaningful legislation, we'll need to work together to craft the policies, and I look forward to working with my Republican co-lead, Mr. Hudson, whom you just heard from. He's a wonderful partner, and I really can't leave you today without paying tribute to my former partner, Susan Brooks. I miss her to this day. She was a wonderful, wonderful member of Congress, and there wasn't any light between us in the work that we did. We both brought our full commitment to PAPA, and her work stands, and I pay tribute to her. As I said, I miss her every day. Every time I look at where she sits, where she sat, I miss her all over again. So if you don't think that we develop really meaningful relationships with members, that is not the case. But we all know that the press is not ever going to carry good news. So I want you to know how special you are to me, the work that you do, what BARDA has accomplished really in its short life as an agency that more than presses its weight. So we will continue the work. I think as we all look over our shoulders and the alphabet soup that is part of the legislative whatever we want to call it, that you've really distinguished yourselves. And you have a full partner in me, and I couldn't mean that more. So bravo to all of you. Thank you again for inviting me here today. To everyone that is part of participating virtually, thank you to all of you as well. My congressional district, I have to brag about it. Everyone brags about their congressional district. Of course they would. Mine is extraordinary. It's the home to Silicon Valley. We have more biotech in the region than any other place in California, any other place in our country. And the work in terms of the partnerships that have been developed are really second to none. So keep up your extraordinary work. And, as we do our work together, I'm always remind myself that what we do here in America matters for the entirety of humankind. The progress that we make, the breakthroughs that are there. And so we have great shoulders that we stand on from the past, but moving forward, we'll keep recreating that. So thank you, everyone. What a pleasure to be here with you. Bravo to all of you. Thank you. Thank you.
So Chairwoman Eshoo, thank you so very much for your perspectives on the history and creation of BARDA and the PAHPA reauthorization to continue to strengthen our health security, and your words of support and encouragement for the work that BARDA has done. It is so very meaningful to all of us. Thank you. Thank you. Thank you. Okay, we are pleased now to introduce to you our keynote speaker. That is Dr. Wolfgang Philipp, and Dr. Philipp leads the new Health Emergency Preparedness and Response Authority, known as HERA, and that sits within the European Commission. HERA's mission is to prevent, detect, and rapidly respond to health emergencies. And HERA works to ensure the development, production, and distribution of medicines, vaccines, and other critical medical countermeasures in the event of health emergencies. Dr. Philipp holds a PhD in microbiology from the University of Paris and has been working in tuberculosis research at the Institut Pasteur in Paris, as well as in universities of Bern and Basel. He joined the European Commission in 2001. So please again extend another warm welcome this morning to Dr. Wolfgang Philipp.
Yes, hello, good morning, everybody. And first of all, I would like to express my gratitude to be invited to today's. Oh, sorry. Is this on now? Okay. I would like to express my gratitude for the invitation to BARDA Industry Days. I'm very sorry that I could not make it this time over the Atlantic. But I have colleagues of mine from HERA on site, and they are certainly happy to enter into any kind of discussion that would help us to further development the Health Emergency Preparedness and Response Authority of the European Union. Next slide. So what is HERA? HERA is not just a new authority. It was created basically during the pandemic, and it was created out of many of the reasons that were already mentioned this morning. And that is really to make sure that we have a better ability to prevent, detect, and in particular, more rapidly respond with the necessary means to all kind of health emergencies that have, at least as we define it here, cross-border effects. And what we have seen during the pandemic is that we were short of medical countermeasures, that we even were short of masks and simple things up to the more sophisticated products like vaccines or drugs. Luckily, the vaccine development and drug development took up speed, massive speed, also due to massive public investments during the beginning of the pandemic on both sides of the Atlantic and across the globe. So HERA is really looking into ensuring that we have means available in the future, that we invest into the right directions, and that means we are seeing it as an end-to-end kind of entity, starting with better means of intelligence gathering and analysis, investing into research and clinical trials where it's needed, in particular to strengthen the translational research parts. We also invest into the development of new medical countermeasures, as well as in production capacities, and also have possibilities to procure and reserve medical countermeasures as it is done already now. But we also, that is done here, we have different parties and different entities at the European Commission to take care of the deployment of these medical countermeasures to places where they're needed. So HERA is a true end-to-end solution and we have been creating it a bit more than 1 year ago. We have a budget of about 6 billion euros, that is roughly $6 billion for the next 5 years to spend. And that's going to be spent, next slide please, that's going to be spent mainly, obviously, in preparedness times, as BARDA as well is doing it. So we are setting up at the moment, we are focusing very much in setting up an intelligence function that combines both epidemiological intelligence, but also supply chain intelligence, as we have seen shortage of critical raw materials, shortage of critical components for the production of medical countermeasures is a big concern, in particular during a pandemic. As I said, we invest through research programs of the European Union into advanced research for the development of specific medical countermeasures, which are responding to the threats identified during our threat assessments. We also make sure that production sites and production capacities of critical components are manageable. That means full autonomy is probably not possible and also not needed, but we should reach stages where for critical medical countermeasures we are able to manage production of those. Procurement and stockpiling is another area where we invest quite some money and quite some budgets, and then also make sure that we are able to build up across the European Union knowledge and skills and build the capacity to better manage not just pandemic preparedness, but also better manage the whole value chain around the availability of critical medical countermeasures. In times of crisis, the situation would change. We would have a different legal base to react faster. And that again is a lesson learned here in Europe, to be able to faster mobilize funding for the procurement and reservation of medical countermeasures. And when I say medical countermeasures, I mainly mean everything you need to detect, treat, or prevent spread of the pathogen or of the pathogens. So we would have a rapid activation of funding, of procurement mechanisms. We would have abilities to activate specific research, but also monitor very specifically a supply chain of critical medical countermeasures. The whole thing is really to allow faster decision-making at the highest political level in the European Union. The next slide, please. This said, obviously HERA is not working in isolation, not at the EU nor at the global level, obviously. But one of the aims and one of the contributions of HERA should be reinforcing global health security while ensuring the availability and access to relevant medical countermeasures. And what we're doing is we're investing into reinforcing surveillance and intelligence gathering. Two aspects which are critically important. That comes also with data management and data sharing at a global level. We address international supply chain bottlenecks, as I mentioned, through our intelligence function, in order to be able to contribute to expand the global production capacity, so not just domestic production capacity, but production capacity of critical components at a global scale. We invest into providing access of EU-funded or EU-procured medical countermeasures for low and middle income countries, and already invest into the development of local manufacturing and distribution capacities in low and middle income countries for relevant medical countermeasures. All of this is done obviously by engaging through bilateral cooperations with countries outside of the EU. We have memorandum of understanding already with the US, HHS, for example, in BARDA. We are working on this with Korea, with Japan, with other countries. We are working also on it on cooperation agreements with international organizations not just WHO, but also others, and obviously engage also through political means, through multilateral fora like G7, G20, and so on and so forth. But coming back to BARDA, and on the next slide, we see the funding mechanisms that we have in place. That's a bit different. Next slide, please. That's a bit different as compared to the situation that, for example, BARDA has. Since we were created only 1 year ago, and the overall new budget was fixed, we had to make use, or we have to make use of existing programs. One is on public health program, the other one is the research program, and the third one is a program under the EU Civil Protection Mechanism. So basically, the last one, the rescEU, here we have a budget of 1.3 billion euros. This is that equals at the moment roughly $1. And that is going to be used for stockpiling. We are concentrating at the moment on stockpiling of CBRN-related medical countermeasures, and also of other additional, that's for next year, additional critical medical countermeasures, medicinal products of all kinds. Under the research program, we have roughly 1.7 billion operating mostly through grants. And as I said, the focus here is on vaccines, on drugs, on diagnostics, and that should go in the area of translational research. And then the health program gives a bit more flexibility as well as a bit more budget. That's about $2.8 billion slash euros. And here we can operate with grants, but also do procurement, like, for example, of vaccines, as we did it for the monkeypox. Next slide, please. Here again, that is just a couple of figures showing that we have a pretty stable kind of allocation or earmarked budgets throughout the different years, but in the range of 700 million to 1.4 billion euros slash dollars. So we are having another 5 years ahead of us, at least in terms of financial planning, and that is something we are looking into very carefully. Also, trying to coordinate and collaborate as much as possible with other like-minded organizations, and that includes BARDA, obviously, where we have great collaboration already in place. The next slide. Here I would like to go through a couple of slides rather quickly to show you what has been done so far in 2021. So we started off with a group of about 10, 15 people towards the end of last year, and now we are reaching a number of around 100. So it's not just the internal development that counts, but also the progress that we have made in certain areas, in particular in the area of preparedness, pandemic preparedness. On the next slide, we see, like, for example, that we have been running a threat prioritization exercise in a very systematic manner, because that guides our activities and our investments into research, into procurement, and into further thinking as well. We are supporting, these are just a couple of examples to illustrate the wide range of activities that we're doing. We're also supporting member states' capacities to expand their capacities for whole genome sequencing and PCR for the sake of surveillance. We have been supporting this with roughly 55 million, also to expand the wastewater, for example, the wastewater surveillance beyond COVID-19, now looking at, for example, as well as antimicrobial resistance and strains that you would find in the wastewater. And another very important accomplishment on our side is the establishment of what we call HERA laboratory network. So that is a network of first-class, top-class international laboratories that have a global reach out, and that will work not just on epidemiology, but in particular on biological characterization of early detected signals. So that is something that should start beginning of next year and would help us to be faster in a reaction to any kind of threat that might show up somewhere in the world, and that might have a potential as a cross-border health threat, as we would call it. Next slide. We are also, I was talking already about the intelligence function, so the EPI function, but also the supply chain function. And here we are investing massively into developing an IT platform that would work and that would help us really to assess situation, map relevant MCMs, help us to manage the stockpile, and also help us to ensure that the systems which are set up and which are run by member states, in particular for any kind of data that would be relevant for our intelligence function, are interoperable with our platform. So that is currently being set up. We hope to have this ready by the end of the year, beginning of 24 latest. And the next slide shows you a couple of examples how we go on with research and development of medical countermeasures. I think it's not a big secret. There is a lot of investments into the area of next generation vaccines on pathogen X, but we also support clinical trials. At the moment, we're looking into means to support clinical trials for for vaccine against the Sudan Ebola strain. And we directly support CEPI as well through grants. You see some figures here that is on a yearly basis, but we also look into innovative diagnostic solutions. So basically, these are investments that might not pay off quickly. Colleagues at BARDA and all other colleagues in the room know how long research can take and what the success rate is. But nevertheless, we see a need to do this, and we are always looking out for means of collaboration here and means of strengthening translational research sector. Next slide, please. In terms of ensuring the access to medical countermeasures, we are currently working on what we call EU FAB. That's kind of an ever-warm network for vaccine production, as we want to reserve certain capacity here. And this is currently under evaluation. We hope to have this up and fixed by next year. We are looking into ways of and means of establishing and investing in smart, flexible manufacturing for medical countermeasures. We are working on means of identifying and analyzing a necessity for stockpiling of antibiotics and other antimicrobials. We are running several studies in this area, as well as looking into means of incentivizing the development of innovative antimicrobials, in particular antibiotics. So all of this is underway. And then here, the last figure, it should not be 1.2 million, should be 1.2 billion. That's what we're spending this year and next year on stockpiles. One part, as I mentioned, on CB1-related stockpiles, and the other part on other critical medical countermeasures. Next slide. I already touched on the way of how we operate. We see a true need for global collaboration. So therefore, with BARDA, that was our first interlocutors and have been very productive and positive discussions with BARDA so far. So that was really helpful also in setting up HERA and shaping our own authority here. But we are working with all kind of entities and public and private entities that have an interest and that are working on means of strengthening pandemic preparedness with a focus on availability, development, research development, availability, and enabling access to critical medical countermeasures for the globe. So that is that's our very intrinsic DNA here. On the next slide, I would like to touch briefly on what we have been achieving in terms of response. So we have so far several agreements, not agreements. These are contracts with 7 vaccine manufacturers, and it is focusing obviously on COVID-19 vaccines. We also have contracts in place for the reservation of pandemic influenza vaccines with 2 companies that have marketing authorization in the EU. But on COVID-19, so far, more than 1 billion doses have been distributed across the EU. More than 500 million doses were shared, donated to third countries, mainly to COVAX, but also through bilateral or multilateral donations from EU member states. But we also have been reserving all available and authorized antivirals and monoclonal antibodies against COVID-19, against SARS-CoV-2 in the EU through joint procurement framework contracts. These joint procurements are done with EU member states. Commission/HERA is doing the negotiations and setting up the contracts for the benefit of EU member states, so that all countries here have access to these products despite if they wish to do so. Next slide shows you also a couple of activities around the monkeypox outbreak that we having here in Europe as well as elsewhere in the world. So we have been able to purchasing and donating more than 300,000 doses of smallpox, last generation smallpox vaccines to the countries. The same counts for the antiviral, and we are supporting clinical trials, cohort studies for these vaccines. With colleagues inside the Commission, we are obviously also working on a private donation scheme. So private means donations from companies to support Ukraine in this terrible situation. But we are also looking now into supporting a WHO sponsored trial for a vaccine against the Sudan strain of Sudan Ebola strain. Sorry. What's next? That we see on the next slide. Please flip to the next one. So that was just a short wrap-up of developments over the past year at HERA. What's next? We will definitely continue to invest in getting our intelligence functions up and running, the laboratory function up and running. The reinforced the horizon scanning for innovative MCMs, and therefore I'm grateful again to BARDA for the invitation and to enable a reach out to present industry. And we will support member states in their capacities to not just deal with COVID-19, but also to invest further into all kind of essential means to strengthen their preparedness, pandemic preparedness capacities. Next slide. Here you see a little bit that's around the R&D side, investments into next generation COVID-19 vaccines and therapeutics, but also into innovative vaccines and antimicrobials, as well broad spectrum antivirals. So that's very much on the focus of our investments. But we are also trying to set up what we call HERA Invest for MCMs, basically a private a fund to attract also private support to have more means of supporting translational research and biotech that works on areas as outlined here on the left side. And then obviously we need to develop a very smart and very inclusive stockpiling strategies for our medical countermeasures. So I would like to say on the next slide, you see an email address under which you can reach us easily, either through that address, through Twitter, we have a Twitter account, or just by emailing me or the colleagues in the room today with you. I would like to say again, thank you very much for the invitation, and all the best for that great meeting.
Thank you, Dr. Philipp, for sharing with us HERA's vision, charge, and approach in protecting health security, both within and outside of the European Union. We look forward to continuing to work with you and HERA in the months ahead. All right, we are, let's see if maybe I have it. All right, there may be an agenda slide that shows up momentarily, but we are about to start the first. There it is, thank you. We are about to start the first of 4 breakout sessions, and each of them has 4 separate sessions, each focused on a specific program area. And during these sessions, you'll hear from speakers from BARDA and from our collaborators across the government and the private sector, and they're all excellent topics. For me, it's a very hard choice when I look at these 16 boxes, which ones to decide to see. The first session starts at 11 o'clock and will run until noon, and then we'll have a break for 1 hour for lunch. The second round will start at 1. The third round starts at 2, and we have a short break, 15-minute break from 3 to 3:15, and then the final session starts at 3:15. So again, we encourage you to stop by the virtual booth that we have, the virtual expo booth, to learn about our strategic plan and resources and opportunities that BARDA has available to help you with your medical countermeasure development efforts. And that is open from 4:20 to 6 p.m. this evening. And if you have not tried it yet, you can still engage with others through the attendee hub, but both directed or focused one-on-one appointment invitations with other attendees, or that instant networking function. And I'm curious if you've tried that. Someone yesterday said to me it's a lot like striking up a conversation while you're waiting in line to order your coffee. Hey, are you at BARDA All Hands? BARDA Industry Day, and learning more about those impromptu conversations. So, all right, in a few minutes, we'll start that first round of breakout sessions. And again, we hope that you find them helpful, informative, and very interesting. And then we will meet back here promptly at 4:15 to hear closing remarks from our BARDA Director, Dr. Gary Disbrow. Thank you all so much again for joining us today, and we hope you really get an exciting morning and afternoon of terrific interactive discussions with all of us, and enjoy your event. Thank you so much.